I'm Dr. Colley, and this is a video to help you prepare for your knee surgery. Let's talk about some of the things that you can do preoperatively prior to your procedure. What are things that you can do to help reduce the amount of bacteria on your skin? Number 1, I recommend obtaining and using Hibiclens antibacterial soap prior to procedure. At a minimum, use this the night before and the morning of. Specific instructions are in your surgical packet. Clean your sheets and pajamas frequently in the weeks leading up to surgery. If you allow pets in the bed, I recommend you keep them out of the bed for 2 weeks prior and 1 month following surgery. This is another way to reduce the amount of bacteria on your skin prior to the procedure. Prior to surgery, there are a couple things you need to obtain from a medical supply store. Number 1, front-wheeled walker. This is most important after surgery. You need to bring this to the hospital to help with your ambulation after surgery. Number 2, a raised toilet seat with arms. Getting on and off the toilet can be difficult after surgery. We do recommend you have this at home. Number 3, compression devices on your legs. These help prevent blood clots after surgery by increasing blood circulation. An order for therapy has been provided in your packet. Please call a physical therapist and schedule the first appointment 5 to 7 days after the procedure. Let's talk about your length of hospital stay. This is determined on many factors, including help at home and your health history. If you have simple medical history, no history of heart disease, no history of diabetes, you may consider going home the same day. If you have complex history such as diabetes, stroke, or heart disease, or inadequate help at home, we may consider staying 1 night in the hospital. A small portion of patients will stay more than 1 night in the hospital due to difficulty with therapy or help at home. We will always make sure that you're safe prior to leaving the hospital. Let's talk about some of the postoperative medications. First, pain control. You will be given a narcotic prescription of either hydrocodone or oxycodone after surgery. If this doesn't have Tylenol mixed in, you may take additional Tylenol in between doses to help with your pain control. You can take 1,000 milligrams of Tylenol 3 times per day. Do not exceed 3,000 milligrams of Tylenol in a day. If you have any liver issues, do not take Tylenol. Anti-inflammatories. Many of my patients will go home on meloxicam or Celebrex after surgery if deemed appropriate. If you are prescribed one of these medications, do not take additional Aleve, ibuprofen, Advil, or Motrin. All patients having a knee replacement will be on some form of blood thinner for 30 days after the procedure. For low-risk groups, this is going to be aspirin 325 milligrams twice per day. High-risk groups will be placed on another blood thinner, such as Xarelto or Eliquis. If you were previously on a blood thinner, we will resume it postoperatively. Arthroscopic procedures, I ask that you take 325 milligrams of aspirin daily for the first 2 weeks. You may be given a prescription for Zofran or ondansetron after surgery. This is usually as a precaution to help prevent nausea and vomiting. If you have this prescription, please take as directed. There are a few over-the-counter medications I recommend. One is Benadryl. Sleeping can be difficult after surgery. I recommend having Benadryl on hand to help you sleep. It can also be helpful if you develop any itching. Constipation. This can be a real problem with patients taking pain medication. I recommend you don't get behind on this. Have Colace around the house and take regularly until you have a normal bowel movement. If it's been more than 24 hours since a normal bowel movement, I recommend Miralax. If after 3 days you still not had a normal bowel movement, you may consider a suppository or fleet enema. Do not let constipation hinder your recovery. Surgery can be stressful on the body. There are some vitamins and supplements I recommend for the first 6 weeks after surgery. In addition to a healthy diet, I would consider supplementing with Boost, Ensure, or a protein shake at each meal. This helps healing and gets your body recovering faster. Vitamin D. Vitamin D supports bone health and healing. I recommend 2,000 units per day. Calcium is good for bone health and mineralization. I recommend 1,000 milligrams of calcium daily. Vitamin C. Vitamin C also boosts immunity and helps prevent against certain types of nerve problems. I recommend 500 milligrams per day for the first 6 weeks. Let's talk about showering after surgery. If you had an arthroscopic procedure, you can remove your dressing after 2 days and apply waterproof band-aids to the incision and shower normally. If you had a knee replacement, please leave your operative dressing in place unless it gets saturated. I recommend sponge bathing for the first 2 weeks until your sutures are removed. If you're absolutely sure that you can keep your surgical dressing dry while showering and covering with a waterproof cover, I'm okay with that. If it does get wet, please call my office. Let's talk about some exercises you can do after surgery. First, when sitting around, don't leave your knee in a slightly flexed position. While this is most comfortable, you can develop a flexion contracture. When sitting with your legs straight, I recommend placing a pillow or pad beneath the ankles to force the legs straight. When sitting in a chair, you can force your knee flexed. Your goal is 90 degrees of flexion by your 2-week post-op visit. I recommend walking 5 to 10 minutes each hour to keep the blood moving. While sitting, you can pump your ankles up and down to move blood by squeezing your calves. What are common things we'll encounter after surgery? First, bruising. This is common, starts in the knee, and typically tracks down to the foot. Swelling is also a common problem after surgery. This is controlled in a few ways. First, our postoperative ACE bandage I recommend leaving in place. Second, elevate. Get the knee above the level of the heart as often as you can to help reduce swelling. And finally, ice. Ice is your friend after surgery. Purchase of an ice machine is convenient but not necessary. You may also consider frozen vegetables or over-the-counter ice packs. I recommend having 3 around the house so that you can alternate. I don't believe that you can ice too much. Do not place directly on the skin to avoid burns. This is especially important after physical therapy or increased activity. Icing for the first few weeks after surgery is going to help with your recovery. I still recommend you read the surgical packet as it has additional details. If you have any questions, please ask myself or my office staff. Finally, thank you for trusting me with your care. I take your recovery very seriously and will do my best to work towards a good outcome.